We always like to start off with current data. I like to make my slides a little bit, because we're in spring, right? And spring colors, and we need something to look forward to. So a lot of people are getting ready for gardening, for flower shows, because we have to keep living throughout this pandemic. So with this, the city of Detroit, as of the end of last week, what we've seen is at least over 124,000 confirmed cases since the pandemic started. There have been reported over 3,300 confirmed deaths. The positivity rate for last week: St. Clair Shores 5.0, Macomb County 4.7, Oakland County 4.9, Washtenaw 5.4, Wayne County 4.5, and we look over to the right and we're looking at Detroit City 2.6. The question you mentioned, Terry, about how do we determine the positivity rates and things of that nature is a very good question, because not everyone's getting tested. So with everyone not getting tested, because we have home tests, we have, maybe just no symptoms, or, I'm just going to stay home and I don't have to get tested. We had to look about it a different way. So what we're doing right now, we're testing and getting these numbers from the waste, believe it or not. We have, and we're dealing with the water department. So that's how the determination of the positivity rate is going about, through our waste, because everyone, I don't want to say it like this, everyone uses the bathroom, right? So we had to, again, look at it a different way. Things are constantly changing, and it's going to have to keep changing as we learn more about it. The city of Detroit right now, vaccination rates, the completed vaccination rate for the city of Detroit right now is 46.3. And that's important to remember, because when we're looking at the right side of the screen and we're looking at Macomb County, 61% vaccinated, Oakland County, 72.3 vaccinated, those numbers are important to know that others around us are getting vaccinated. So if we can, in the city of Detroit, we're definitely recommending, if you can get vaccinated, get vaccinated. The whole Michigan entirety is 61.3 being vaccinated. And if you look at the left side of the screen, it kind of breaks it up into age groups of who's been vaccinated. And we're looking at our age group of 65 to 74 that are at least 75% vaccinated. Because we know in the beginning of the pandemic, they were the most that was in harm, that we were losing. So we can, encourage our young people to call the Detroit Health Department with their parents. We can definitely, sit down and talk with them. And let's talk about getting vaccinated, what that looks like, continuing to get them social, just like that video that just came, or we just seen. When the children got back out there, they were excited to see people. But how can we protect them? By getting vaccinated. We urge people, we recommend everyone call your primary care physician, like that couple did, and talk, have those conversations. And looking at how to stay in control. First of all, take a deep breath. We're all tired of hearing about COVID. We're anxious about, dealing with COVID. Should I wear a mask? Things changed from I won't even say from day to day, from hour to hour, because we may learn something else in the next 5 minutes that we didn't know 5 minutes ago. So yes, things are changing. Check your surroundings, check your data. You can go to detroitmich.gov and look at planning ahead. If you're going to an event and you are looking at, well, let me put in that zip code and see what their positivity rate is. You can do that. That helps you stay in control. Keep utilizing your tools. Taking your COVID test if you're unsure. If you're going to an event, take a COVID test. It won't hurt. But just to be sure, so you can protect yourself, you can protect others around you. And then, me as a medical professional, I'm always going to encourage hand washing, hand hygiene. We were encouraging this before the pandemic, wash your hands. That's important. Well, because we still have colds, we still have flu, we still have so many other things going around that we can prevent just from washing your hands. And yeah, there's different things. Again, I mentioned about things changing as far as putting on a mask. If you're uncomfortable about your surroundings, if you're anxious, put a mask on. Protect yourself. It's okay to say, you know what, I'm going to protect myself because I feel comfortable wearing a mask. It's okay. If you feel uncomfortable not wearing a mask, that's up to you. But we highly recommend, because of our vaccination rates, because of our positivity rate, it's not down to a zero. We're still in a pandemic, to wear your mask. We know that the data has proven getting vaccinated helps. Hand hygiene, social distancing, not going to that party, might be really important. Although we're social creatures, yeah, we still want to do it. But at the same time, we need to stop and think. Test and stay home if you're sick. We talked about masks in Detroit. If you need to test, call 313-230-0505 to schedule an appointment. You might just have a headache, a cough, nasal drainage. Something so simple could actually be COVID, or just a simple something else. But it's better to know than to not know. So I like to encourage, Detroit is stronger together. I talked about our kids getting vaccinated if they can. We have 2 locations at the Northwest Activity Center that's available, and also the Detroit Health Department at 100 Mack Avenue. You can schedule your children from 5 to 11, ages 5 to 11, by calling 313-230-0505. We're still in America are only providing 3 vaccines: Pfizer, Moderna, Johnson & Johnson. Now, COVID vaccines we do have more locations than this. These are our weekly, always functioning locations: the Northwest Activity Center, the Detroit Health Department, Samaritan Center, and we still have our Saturday locations. We do have pop-up areas, grocery stores, and things of that nature. But to find out, call the 230-0505 number. I just want to mention because we did have some new changes, right? Everybody's asking, is the 4th dose or 4th, what's this? Should I get this vaccine the 4th time? I'm not getting this vaccine. I'm not doing it anymore. Or just explain to me what it means. Not a problem. So, or what being fully vaccinated means, right? We got people going on cruises, getting ready to travel. It's getting ready to be summertime. And people, again, we're social. So we want to get out there. We want to interact. So to be fully vaccinated, for individuals that are not immunocompromised, 2 doses, your first and your second dose of Pfizer or Moderna, 3 weeks for Pfizer, 4 weeks for Moderna, you're fully vaccinated. A booster 5 months after adds a level of protection, but you've already been fully vaccinated. Johnson & Johnson, again, that's still 1 dose. Another additional layer of protection is 2 months after with an mRNA, or you can get Johnson & Johnson if you don't want to get the Johnson & Johnson. Now, with the third dose for immunocompromised, what we're looking at to be fully vaccinated, 3 doses of Pfizer or Moderna, because those individuals severely or mild immunocompromised needed to be brought up to our level of 2 doses. That puts them at a level where we kind of are if we're not immunocompromised. And then on top of that, there's an additional booster 5 months after the Moderna and Pfizer. For Johnson & Johnson, there's 1 dose to be fully vaccinated. For immunocompromised, you're going to get that second vaccine. So it's 2 doses for Johnson & Johnson. Then you're fully vaccinated. I know it's so confusing. If you have questions, we recommend calling your primary care physician or calling us at the City of Detroit Health Department, 876-4000. We do have a nurse's line. We like to talk. We like to explain it. The 4th dose is 4 months after you have had your first booster, 4 months after.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.